Welcome to our show, Ask Your Doctor. I'm your host, Shivani Raj. For today's show, we have Dr. Kumar. Dr. Kumar is a board certified in reproductive endocrinology and gynecology and practices near Los Angeles, California. In recent years, Dr. Kumar has focused his efforts for those that have a difficulty conceiving and require a third party reproduction, which can be egg donors or gestational surrogacy. Over half of his current patients are from overseas, which include Australia, Austria, China, France, Germany, India, the United Kingdom, etc. Combining meticulous attention to detail, 7-day-a-week work ethic, the best staff support, nursing and embryology, and the latest in technology, he is able to obtain the highest pregnancy rates achievable today. He has been asked to present his work across the world, including different countries like Australia, India, China, and Italy, and has contacts in numerous clinics that collaborate closely to provide seamless care. So without any further delay, let's welcome him onto our show. Hello, doctor. I hope you're doing great. First of all, welcome to our show.
Thank you so much for having me. We're doing really well.
First of all, doctor, it would be great if you can give, talk about what you exactly do to the viewers watching the show right now.
So mainly we focus on IVF, in vitro fertilization, and we do all aspects of IVF. That would include, a couple that want to conceive together and she wants to carry herself. And we do that in addition to women that have run out of eggs, need egg donors. And obviously, women that want somebody else to carry a pregnancy, that would be a gestational carrier. We also work a lot with same-sex couples, so gay men that want to have babies through egg donors and surrogates.
Yes. So, doctor, let's get on to the topic. I think the major cause for all of these is infertility, and the rates of infertility has grown over the past 10 to 20 years rapidly. So, what is your view on that? Like, why do you think infertility is a huge problem nowadays? Is it because of the lifestyle changes, or anything, hormonal? Can you just give your view on this?
So I think that if you look at the data, the prevalence of infertility hasn't really changed. I think the stigmata associated with it has changed. Whereas a generation ago, if there were fertility concerns, we would tend to hide it and not want to talk about it. Now we're more and more open about it. And so that, I think, is changing. It leads to the idea that we're having a higher prevalence of fertility, but the rates have been same for past couple hundred years. About 1 out of 8 couples will need fertility treatment. Reason for fertility or infertility has changed. In India might be a little bit different because most Indian patients that I have are a little bit on the younger side. There are a handful of patients from Delhi, Mumbai that are older that need egg donors and or surrogacy, but a lot of them are younger. On the other hand, if I look at across the world, a lot more of my patients are older now. They've spent their 30s working on their careers, and now in their 40s, they realize that family is an important part of life as well. What is interesting, and I don't know if it's changed, but it might just be a part of our genetics. As Indians, we do have lower ovarian reserve than Caucasians and other ethnicities. So it's kind of interesting that genetically we're born with fewer eggs and or we go through them faster in life so that we're more likely to need egg donors than others at the same age.
So, doctor, let's deeply discuss on IVF. IVF, I think, has been become popular here in India, especially for the past 10 years maximum. So, can you please explain what exactly is IVF and what kind of couples can consider it?
Sure. IVF is a really interesting manipulation of a regular ovulatory menstrual cycle. So what happens is that a young woman, let's say in her 20s or 30s, is going to release one egg or ovulate one egg each month, but she will lose over 1,000 eggs in that month. So that means that every few days there are 20, 30, 40 eggs that present themselves that want to be the one egg that's released that month. If the right hormones are there, they start to grow. If not, they die out, and a few days later, another 20 or 30 show up. But when the right hormones are there, all those eggs start to grow, but then the brain cuts down on the stimulation hormone, so all of the other eggs except for one starve and die off. And only one then grows to maturity and is released. The rest of them die off. What we do with IVF is we administer the same hormones that the brain would make subcutaneously in a tiny little injection in the tummy. And the individual would take the injections for approximately 9 or 10 days. And then 2 days later, we remove the eggs straight from the ovary before they're released into the pelvis. We take those eggs, and either with IVF, we just put 10 to 15,000 sperm around the egg and let fertilization occur on its own, or we take each individual sperm, break the tail, and inject it into the egg. That process is called ICSI, or intracytoplasmic sperm injection. Taking the eggs out of the ovaries would treat someone with tubal factor infertility, someone whose fallopian tubes are blocked. Injecting the sperm into the egg would treat male factor fertility, someone that has poor quality sperm or sperm that don't swim well. So after fertilization, we grow the embryo for 5 to 6 days. At that point, we call it a blastocyst. We have a hard shell like a helmet. Within that, we have a hollow ball of cells like a football. And within the football, we have a solid ball of cells like a cricket ball. What we do is a test called pre-implantation genetic testing for aneuploidy, PGTA. We can take a laser, cut a hole in the shell, and take a few cells from the football. The embryo is then frozen away safely in liquid nitrogen, and then the cells are used for testing. We extract the DNA from the cells, and we make an assumption that those cells represent the whole, which is valid the vast majority of the time, 97, 98% of the time. And then we can check the DNA in those cells to confirm that we have an accurate number or appropriate number of chromosomes. And we can also then, if need be, check for individual genetic diseases. Like in us Indians, thalassemia is a common mutation to have. If we have 1 or 2 mutations, then we're okay. But if we have more than that, then we can be severely affected to where we need transfusions for our entire lives. And that means now we can go in and check each embryo. Let's say we have 10 embryos. We can check them all to see how many mutations each one of them have, and then only transfer the ones with minimal amount of mutations, and therefore will have a healthy life. So that's called PGTM. So you can see from the complete control we have over reproduction, we can treat a variety of disorders.
Yes. So doctor, I think this is one of the common FAQs that you get, on daily basis. But like, is having a baby through IVF safe? And is it like, how much is it safe? And also, like, are the hormonal injections that you give, are they painful? Is there anything that you want the parents who are considering IVF to know?
Yeah, so they'll be in trouble for the next 20 years raising their kids. The hormones are safe. So let's talk a little bit about safety of the person going through ovarian stimulation, and then safety to the offspring. So many years ago, there was an association between Clomid. Clomid is a very commonly used fertility medication. There was an association between Clomid use and ovarian cancer. And it was actually comparing two incorrect groups of people. So when they looked at it in more depth, it was an infertility diagnosis that increased the risk of ovarian cancer and not the Clomid use. It's just that only women with infertility use Clomid. So if a woman is infertile, she will ovulate more frequently over her life, or have more ovulatory events over her life. And with that, the chance of ovarian cancer goes up. So that if we look at women that are infertile and don't take Clomid to women that are infertile and take Clomid, the chance of ovarian cancer is the same. And they've looked at fertility medications, and they don't increase the chance of cancer in the person going through stimulation. Yeah. We just talked about with testing for aneuploidy, with testing for individual diseases, we can actually lower the chance of miscarriage and increase the chance of a healthier baby. There have been some effects on the offspring that have been noted, specifically that the baby might be a little bit smaller, may come a little bit earlier, but in the grand scheme of things, the child is likely to be equally healthy, conceived spontaneously or through IVF.
Yes. So doctor, let's talk about this popular topic. I think egg freezing has become very popular over the past 5 years here in India. I'm just talking about India. So a lot of women especially are considering egg freezing. Working women about 35, they are nowadays, they're like, okay, fine, I think it's time for me to freeze my egg if they're not married or are not considering having kids as of for next 2-3 years. So can you explain from the basic about what exactly is egg freezing?
Egg freezing is where we do the same ovarian stimulation as we would for IVF. So the 20-30 eggs that were going to die out and only one would be released, we actually get all of them to grow and we take them out and we take the support cells off of the eggs and we freeze them in liquid nitrogen. Now, I think that there is a little bit of a misconception that we can consider this if we're 35 and over and a single, et cetera, et cetera. It may be too late if we wait that long. And I think that's where I'd like people to be a little bit more alert. The concept is called ovarian reserve. And it's a really important concept that I think should be taught in schools that all young ladies, young women should know about. So ovarian reserve encompasses two ideas: the number of eggs in the ovaries and the quality of the eggs. And the quality is even more important than the number. If we back up a little bit, when boys are born, boys make no sperm. Boys go through puberty, start making sperm. They'll make sperm their entire lives. The decline in sperm is about 1% per year, so pretty minimal. On the other hand, a female fetus, so a girl inside her mother's womb, halfway through her pregnancy at 20 weeks gestational age, will make all the eggs she'll ever have. And the numbers I'm going to give you are for the Caucasian population. Remember, as Indians, we have a lower ovarian reserve as a group of people. As individuals, we may be anywhere across that bell-shaped curve, but as a group, we're definitely lower than Caucasians. So at 20 weeks gestational age, we're looking at 6 to 8 million eggs. We lose most of them by birth, and we're down to 1 million by birth. By age 13, 300 to 400,000. Age 37, 25,000. After age 33 or 34, the decline is rapid. It's like falling off a cliff. Okay. The second part of that is the quality. Quality is when the egg is made, it's packaged with 92 chromosomes. With ovulation, 46 are pulled to one side, 46 to the other, and 46 are thrown out like trash. The 46 that are retained are put in the middle again, 23 to one side, 23 to the other, 23 are thrown out, 23 come in from the sperm, and we have a new embryo, a new fetus, right? But what happens in the separation is that sometimes there's unequal separation, and we can have more or less retained. And that's called aneuploidy. The best example would be Down syndrome, Edwards, Patau, Klinefelter's, Turner's. None of those are good outcomes we'd like to avoid. And the frequency of that increases exponentially as we get older, just like miscarriages increase exponentially as we get older for the exact same reason. So that when we look at a woman in her 20s, roughly 2 out of 3 embryos are going to be good. Woman in her 30s, it drops to 1 out of 3. In the mid 40s, 1 out of 10. So even if we freeze the eggs, the likelihood that they're going to result in an embryo that will be a healthy live born decreases dramatically after age 33, 34. So the idea that we wait till we're older than 35 and then think, hey, we may need an insurance policy, might be trying to like buy a health insurance policy on the way to the hospital in an ambulance. It maybe get a little late. I myself have an 18-year-old daughter. And when she's in college, whenever she has a week or two, I'm going to get her to freeze her eggs. She unfortunately wants to follow in my footsteps and wants to become a physician as well. And by the time she finishes in the US, she'll be in her mid-30s. It's going to be very late for her. And so why wait to freeze the eggs until we have less and they're of poor quality? Less. Why not do it earlier when we can get a lot more easily and they're going to be excellent quality?
I think that's actually a very beautiful explanation from your doctor. having a kid out there in USA and other countries is a very personal thing. But here in India, it's like a huge deal. Even before the couple itself are ready to have a kid, they're basically forced into having kids and stuff. So when it comes to that, I think a lot of blame for not having kids have gone to women. Now that a lot of women have started working, of course, there's a different lifestyle changes, and everything that happens. Oh, she is not having kids. It's because of her. It's her problem. It's because she is not sleeping right. So a lot of blame goes to a woman. So as a gynecologist, as an endocrinologist, how important is it for a man also to keep their reproductive health good for having kids in future? I think that of course having a kid is both of them are equally responsible. So what are your thoughts on this?
I think let's take a step back. What you said is really important. It is not all the women. If we look at it in general, right? A third of it is male factor, a third female factor, and a third unexplained infertility. In terms of the third male and a third female, there's a lot of overlap where we have several issues going on. Okay? And the idea that we can take control of our reproductive health is a falsehood. Okay? So, and I think that that's where the blame goes out of it. You're not God. I'm not God. And that means we don't have complete control over ourselves. We have to deal with the circumstances that our genetics have put us in. So if genetically I'm born with very few eggs or I run out, then how am I the cause? I'm not. Genetically, if my sperm is very poor in quality, then how can I work on my reproductive health? I cannot. But I think that stigma and the blame has to go out of it. Once we remove that and we understand that, hey, if I need glasses, it doesn't make me a lesser of a human being, less of a son, of a partner, whatever. It's just like any other medical issue. The same is reproduction. I don't deserve to have infertility. That guilt that we put on that person, like, what did you do to deserve this, to own this? Your diet, your lifestyle, you're not healthy enough. No, most of it is genetics, right? One of the most common disorders that leads to infertility is polycystic ovary syndrome. It's a genetic disorder. You didn't do anything to bring it upon yourself. You inherited it. It's in your genes, right? And so it's not a woman's fault. It's not a man's fault. It's just circumstances.
A lot of people nowadays, I think it's been like since 2 or 3 years that surrogacy here in India has become, now people want to talk about it. I think mostly it's because of the film industry that's happening. A lot of celebrities are having, kids via surrogacy. And, of course, let's just put aside all that stigma that, oh my God, just because she is not carrying that child, she's not the mother directly. But can you please explain about surrogacy and educate people watching the show that even though you're having a kid via surrogacy, that still is your kid? So can you please explain that in a very normal terminology to the viewers?
Sure. So if we think that my son or my daughter, my genetic contribution was the sperm, my wife's genetic contribution was the egg, right? The egg and sperm came together, and then they were put in an incubator, and that incubator kept them warm and safe for 9 months, and then they came into this world. But genetically, my link to my son, other than me taking care of him, is the DNA that was passed to him through the sperm. Similarly, for my wife, the DNA that was passed to my son and to my daughter through her eggs is a genetic link, and that is the blueprint for who they are. And physically, their makeup of their brain, etc. So that is it. That's the sole thing that passes through. The uterus itself, as amazing as it is essentially an incubator. It confers no genetic effect to the fetus. So we can take an embryo that's taking eggs from the intended mother, sperm from the intended father, combine them, put them in a uterus, And that surrogate's uterus will not affect the genetics of the baby at all. So when the baby comes out, it's the same as if the intended mother had carried the pregnancy or any other woman on the planet had carried a pregnancy. The baby will be completely their own genetics and no other genetics at all.
Yes. So doctor, can you please talk about what exactly is embryo freezing? We did talk about egg freezing. How different are they compared to each other?
They're very different in terms of the level of security. One of the things that we discussed in egg freezing is that the likelihood of a normal embryo is different depending on age. When we freeze an egg, we don't know if the genetics inside it are good or not. We are playing the odds. I know that in a woman in her mid-20s, if she has 8 eggs, that will guarantee me at least one baby, right? And that number may change a lot by if we look at somebody in her 40s, we may need 20, 30 eggs. But we don't know. It could be that 5 eggs may do it for her. She may have really good egg quality. We don't know. We just are playing life by the odds. But when we freeze an embryo, especially if we do that PGT testing, then what we can do is take cells from the embryo and know that the embryo has a good chance of implantation and resulting in a live birth. What if I'm like, let's say 37? I have 5 embryos. If I don't test, I don't know how many healthy babies I can get out of it. But if I test and have 3 normal ones, then I know most likely I can have 2 babies. If I only have 1 normal, then I might want to do another IVF cycle and freeze more embryos so that I know I can have my 2 or 3 kids that I'm going to want in the future. So there's a lot more certainty to freezing embryos, especially if we test them to see which ones are viable or not. Downside of freezing embryos is that we need sperm. So if it's a single woman, then she'll obviously have to get donor sperm.
Yes. Everybody wants to make some extra money, and this extra money, a lot of people also consider sperm donation, egg donation, and all of these. These are actually getting popular here in India also. So can you talk about the cons of having, donating way too much, or like can we just like wrap it up and maybe explain a little about it?
Yes, I think it used to, like in the US, so a young lady is allowed to donate 6 times. And I don't think there's any limit on sperm donation for men. In India, there was no limit before, but now I think the limit is that a young lady can only donate once. I don't know about the laws governing sperm donation for men. So in terms of the cons, I guess it would be the psychological knowledge that you may have offspring out there that are genetically linked that you're unaware of. But I think that the pros are that, if we think about this life being very challenging in a different way for each of us, if we can give of ourselves in an altruistic way, and even though they're being financially compensated, I still think that's a hugely altruistic act. If we can give of ourselves and make our community better, stronger, and more whole, then I think we add to the beauty and the love in the world, then it's a really big positive.
Yes. And finally, doctor, I think of course IVF and all the procedures that you've mentioned and we've talked about are very personal. And I think a lot of it's I think it's one of the most beautiful things that you're doing. So as a doctor and from your clinic, how is there anything that you want to tell to the viewers or who are considering IVF, who can come reach out to you? Is there anything that you want to personally tell them?
Yes, I think that what they're aiming for is amazing and beautiful, right? They have children. I think it gives you a different level of contentment and happiness. We can live a hedonistic lifestyle and you can reach a certain amount of happiness or contentment. Having more chocolate or whatever is not going to make you happier, right? And when you have children, you go to a different level because when somebody else's happiness makes you happy, that I think that's truly amazing, right? And it's that unconditional love that we can experience from our children that I think gives us the full contentment we need in life. And so when we're aiming for something that's that beautiful, life-changing, then we need to let go of guilt, let go of the stigma, embrace the beauty that it has to hold for us and go for it and not not beat ourselves up about it. I think there's so many different ways to have children, so many right ways to have children. We have to kind of as much as I think being Indian is about being traditional, right? I think that as we enter into this new phase of our existence of our country, that to be able to shed some of the negatives, the stigma that put on everything, to stop the blame game, to just, hey, it's not your fault, let's just get you pregnant, and to embrace the different opportunities that lie before us.
Yes. Thank you so much, Doctor, for joining onto our show. I think it's going to be one of my favorite shows because whatever you said, I think it literally came out of your heart. And again, thank you for joining onto our show. I would also thank the viewers for tuning in. You're watching Sakshi TV with me, Shivani Raj.